everyone. Welcome to the official podcast by SOA English Cafe in association with SOA Photography Club for the National Conference on Sustainability and Innovation in Healthcare 2026 in collaboration with CAHO. The future of healthcare is innovation and responsibility, which brings us to an important question. How can we make sustainability become a part of this journey? To explore this avenue, we have a distinguished IFS officer and chairman of State Environment Impact Assessment Authority, Dr. Sudarsan Panda, with us. Hello, sir.
Thank you.
Before we begin with the podcast, I'd like to take a moment to ask you how you are doing today and how has your experience been so far in Sustain Health 2026?
First of all, I will congratulate the SWA University and the panel of professors here who has aptly organized this particular national seminar on sustainability and healthcare. You know that sustainable health is one of our prime objective, not only in our country, throughout the world. 2015, when the United Nations adopted sustainable goals for the entire world, this health, well-being of the people and healthcare has been assigned number 3 position out of 17 priority goals, developmental priority goals. That shows how important the healthcare is for humankind. Unless otherwise you have a proper health and good health, the country cannot develop, the society cannot develop. And at the same time, you should have some sort of healthcare which is sustainable. That is why we talk about sustainable healthcare. And I am very happy to know that in this particular national workshop, people across various sectors, including healthcare, academicians, professionals from IT sector, industries, community organizations, students, and many more people, all stakeholders of the society, are participating and expressing their views on this particular topic. It's a good beginning, and providing a sustainable healthcare. When you listen to this, it sounds good, but a country like ours is very, very difficult to implement it because the sustainability is a very broad word which is used by all sections of the society, including the academicians, to people, to policymakers, to all everywhere, every country. I am giving you a brief, whatever your questions are, most of the I'll give my talk on that. So when you talk about sustainability, that means you have to continue this good work for generations without causing any harm to anybody, including the environment. When you talk about sustainable growth, that means the growth should be continuous, not that after 5 years we will fall down. So the growth should be continuous without any negative major impact on environment and other factors. We have to live in this planet. So that means we have to have a balance between development, environment, and all sectors of the environment, like the living components, non-living components, the resources that we have. So that everything should be in a balanced form. That is why we talk about sustainability. I know that some years back, the World Health Organization, the director has said, sustainable healthcare is providing health to the people now without affecting the environment tomorrow. So all these things, sustainable health, it has many sectors, many branches, and I am happy that all people, those who are matter in the sustainability of the healthcare, are present in this seminar.
That's a wonderful remark on sustainability, sir. I would say that sustainability in today's time plays a vital role in healthcare. Moving forward with the questions, healthcare infrastructure is expanding rapidly in India. From the perspective of environmental assessment, how can hospitals and healthcare facilities be designed to minimize their environmental impact from the very beginning?
All these developmental works, including the hospitals, big buildings, residential, mining, industries, everywhere. whatever human development works are going on anywhere in the world, it has some impact on environment. Without impact, it's not possible to have any development nowadays in the modern world. Earlier, that in the old age and iron age and stone age, that's a different age. Now, in the modern age, it's not possible. So, what is required is to assess whatever the impacts, negative impacts, this particular project or this particular uh, institution or particular industry will have on the environment, and what sort of mitigation measures have to be taken to minimize the negative impact. That is why the government is in all development projects we insist on environment impact assessment studies. We say that what is the present situation, if the project is coming, what are the negative impacts on the environment, and what is the mitigation plan to address those problems and to minimize the problem. So it starts from the building. It's not only for the the disposal with the waste. It starts from the building design. So many things we say that is the design should be design of the building, including all the hospitals or the or other buildings, should be designed in the way that you should have minimum carbon footprint, minimum use of resources, including electricity, water, or the minimum footprint of the people and the project. That is why from the designing itself and the location of the project, it is also equally important. So you have to think about many things while establishing any hospital and functioning in the hospital. Functioning in the hospital nowadays, it's gradually being automated. You have to many modern countries and many modern hospitals, they are using artificial intelligence nowadays to regulate many things, and that helps the policymakers and the administrators to take quick decisions.
Yes, sir, definitely. As you said, environment impact assessment would be the first step to building future ready infrastructure. So, my next question is, hospitals generate significant biomedical and plastic waste. What role can environmental regulatory body play in encouraging more sustainable waste management practices in these healthcare institutions?
Not only the polythene, plastics, and many disposables, and maybe the biomedical waste, there are specific rules and regulations of doing that. So there are biomedical waste rules, there are disposal of plastic rules. There are all each and every country, every state in our country have specific rules, and that implementation of the rules is a problem. The implement the, you can have n number of guidelines and acts, but the implementation is required for implementing that set of provisions. The implementing agents in the state is mostly the State Pollution Control Board, maybe the police organization, maybe in the urban development agencies. So where we have problems of implementation, because unless otherwise people are made aware of, people they should feel that okay, this is a problem in our society. Unless otherwise the awareness is there, you cannot just control by enacting rules and regulations and policies. And enforcement agencies is finding it very difficult to implement such type of thing where each and 90% of the population is using plastics, and they do not know where to throw, how to dispose it of. There are specific areas where it can be done and it can be recycled, reused, but that sort of uh, attitudinal change is not happening in our society as desired. It's happening slowly for last 10 years, 20 years. We feel that it is happening slowly, but the attitudinal change is not happening as per our desire or in a desired way.
Yes, sir, absolutely. Implementation becomes the most important part in making healthcare systems more sustainable. Moving on, sir, climate change is also increasingly affecting public health. How can environmental governance and their frameworks help healthcare systems become more resilient towards these climate related challenges?
So now we have talking about many things: climate resilient structures,
Yes.
climate resilient buildings. So now in the coastal areas in our state, we are facing frequent cyclones, frequent floods, and in those times, the healthcare facilities is practically negligent. And in the remote areas, we are not having finding any scope for treatment of the people and what the mostly the marginalized people. So we have to think about how to make our hospitals climate resilient and how it is not only we made hospitals or modern healthcare, it should be affordable, it should be reachable by the people. Unless otherwise, that is there is no question and there is no meaning of healthcare system. The country will develop unless otherwise we develop that sort of system which is approachable and affordable by the common public. And nowadays, you say we are also India is also developing and already developed the movable clinics, and it's being tried in Indian Army in recent years. They will carry that folded structures with equipment and to the high altitudes where no medical facilities available for our Jawans and army people, and they will be providing medical facilities there, which is the makeshift arrangement. We should have that sort of facilities also for our people who are living in inaccessible areas. Telemedicine is another aspect that we have to focus on. So many things are to be done, but we are lagging behind as compared to the many developed states like Singapore or Netherlands or European Union or many other countries where hospitals are much more advanced, much more approachable, may not be affordable as far as Indian currency is concerned, but they have different systems and schemes to treat their citizens.
Yes, sir, that was absolutely insightful. Uh, Looking ahead, how can collaboration between environmental authorities and the healthcare sector and their authorities help create healthier and more sustainable cities?
Definitely. So, when I was talking about the sustainable goals, one of the important parameters, pillars of that particular concept is the coordination and collaboration. Unless otherwise you coordinate, collaborate, and have a networking, it's not possible to do entire work with a single institution. So that is why this particular seminar, what the SWA has organized, is a tremendous effect because all stakeholders are attending the national seminar and they are expressing their opinion, and many good practices also, maybe the best practices they must have shared. And I think these sort of platforms should be more and more organized in our country or in our state so that people, specifically those people who are involved in the process, are sensitized, people are more aware of, and then we can have some sort of positive step looking forward. And I feel with this sort of coordination, with this sort of thinking, with this sort of attitude, we can have sustainable healthcare in our country. It's not a necessity, it is our duty, it is our effort, it is our primary fundamental responsibility to do that.
Yes, sir, absolutely. Collaboration is a very important part, and Sustain Health 2026 is definitely taking this one step forward. Sir, finally, I would like to ask you, what advice do you have for all the young professionals who are watching this and who are moving into the healthcare sector? How can they approach the healthcare sector to make it more sustainable?
So the sustainable healthcare now the students they are much more aware of, because during our olden days nobody was talking about sustainability or sustainable healthcare. Why it is happening now? Because the mature people or mature professionals they feel that we are probably are not going in a right way. Now the young students they are well aware of what to do, what not to do. The best thing they can do is at their own level they have to reduce the carbon footprint. At their institution level, they have to put their heads together and see that how they can optimally use the resources. Maybe the light, maybe the wind, maybe the water, maybe the whatever natural resources available at their disposal. They should be in a position and a mind frame to use it judiciously. Then only the sustainable healthcare will come into effect, and I am very hopeful. I am very optimistic that it will happen. It will happen in our country very soon, maybe within a decade, and it should be a happy occasion to observe that.
Yes, sir, definitely. I hope that all the viewers and young professionals watching this are taking notes, and I'm sure that they will find this conversation very insightful. Thank you so much for joining us today and having this beautiful conversation with us.
Thank you very much.
Thank you so much. Thank you.